So the day of, like, I walked up the flight of stairs to my second floor apartment, totally fine, no pain. I rested that day, but I don't even think I took ibuprofen that day. I took a little bit the next day, and then after that, like, I haven't taken anything. I've had zero pain, even without any kind of anti-inflammatory, so.
Okay, and then your pre-op pain compared to now, has it been addressed?
Yeah, night and day.
I got dressed and everything, no issue, didn't need help or anything, and then walked out of the hospital. Immediately went to the grocery store and walked around just to pick up some Advil essentially, and then went home.
And literally the next day after surgery, that arthritic feeling was, if it was like a constant 5 or 6 on that pain scale, it was down to like a 1 or 2.
I was up and kind of hobbling around that evening. Worked out probably, it was actually exactly a week later.
What kind of activities were you doing?
Sure. So 2 weeks after I was full back to work, so I'm a pilot, so I was flying airplanes. Our flight doctor cleared me to do that.
Day after surgery, what kind of activities were you doing? Were you laying low?
No, I drove myself to the farmer's market and just normal activities.
Yeah.
The next day, I was walking, not 100%, but way better than I was expecting.
And then I took some Tylenol and ibuprofen after surgery, but I had essentially no pain.
I only took ibuprofen and Advil, and I only took those for the first 2 to 3 days after surgery.
Okay.
Didn't really do much. I know I was supposed to take Tylenol and Advil, but I only took that for swelling. So if it didn't feel like it was painful, if it wasn't very swollen, most of the time I just iced it and elevated it. So,
okay.
Like I said, I was really happy with the option to be able to stay awake and not deal with like the anesthesia
For me, staying awake was just a better option. Plus, like, you and me, like the whole team in there, we're all just chatting the whole time, which is pretty anxiety reducing. So for me, that was like the fun part. Even though I was getting my knee worked on, chatting up everybody and just talking was pretty stress relieving for sure.
Kind of a difference.
Even some of the people talk about the surgery timeline. I thought it'd be neat to be awake and watch it, and it was.
It's a lot better immediately after surgery. I mean, I was in recovery for maybe 15 minutes, and then I was pretty much packing up, ready to go home. So it was a lot quicker. I got to get back on my feet right away. I walked out the day of. I mean, they wheeled me out.
I thought I'd see some on the scope, but what I really liked was like how interactive it was. I mean, the initial time I asked you a question, I was like, I don't want to disturb you. I don't want to, but you were, very open to asking questions. You would explain what you were doing as you were doing it. You one point.
I'm glad I did it because it's way easier than I was expecting.
Yeah.
Literally, it was kind of over and done with, and I was, zero pain, zero. Yeah. It wasn't uncomfortable. It was absolutely fine.
Good. And then recovery in the recovery room, you didn't have any of the nausea or anything like that? Okay.
I felt absolutely fine.
Okay.
Incisions have healed really, really quickly, really well. I was training the Monday following surgery, so like 3 days post-op, so that's pretty awesome.
Yeah, it's amazing how small you can hardly see the incision was.
Crazy technology, right?
The physical therapist was like, wow. Yeah.
Anything you wish you would have known beforehand, or any suggestions you would give to other patients that are...
I wish this technique was available 10, 15 years ago. But no, I'd say if you are a candidate for this, then definitely consider it over everything else, because the not having to be knocked out, the super small, basically not needing stitches, I think that technique and that tool makes it really easy for like you as a surgeon to go in and see lots of different viewpoints, gives you the best method to figure out how to do what you need to do to clean it up or repair it.